Hello, my name is Audran Mollard and I will now present to you my part of our oral presentation about Etizolam. I will start with the synthesis. So there is many different ways of synthesize Etizolam. One way is by starting with a precursor with a similar structure to Etizolam, such as thienodiazepine 2-on. You can see the structure here. With this method, you have to replace the keto group with the hydrazino group and then perform a condensation on this hydrazino group to obtain the Etizolam structure. You can also replace the keto group by a acid hydrazone group and then perform a cyclization of this group to obtain the Etizolam. Also, there is other way of synthesize Etizolam with less complex precursor such as thiophene and 2-chlorobenzonitrile. I will not describe this method because I already did it in the individual report about Etizolam, but this method are probably more interesting in economical, ecological, and safety point of view because these methods are used in the country where it is still manufactured and it is legal. Now I go to the analysis technique. So for the blood sample and urine sample, you can use a combination of HPLC and mass detector to quantify this sample. You have to draw a calibration curve with a standard solution at 1 milligram per milliliter diluted in the mobile phase at different concentration. Then you prepare for the preparation of the sample. You have to add formic acid at 26.7 millimole per liter in each sample to adjust the pH. Then the sample are placed in a centrifuge at 5,000 rand per minute during 30 minutes. And then you inject the supernatant phase with a syringe in the HPLC. Another forensic toxicology technique used for blood sample is the ELISA immunoassay. It uses the antigen and antibody involved by the presence of Etizolam in the body with an enzyme colored substance that allows us to detect and quantify the molecule by using a calibration curve. The detection limit is at 2.5 microgram per milliliter for this method. Now I go to the conclusion. So, as my collaborator said before, Etizolam is a central nervous system depressant with a similar action to other benzodiazepine derivative, and it acts on the GABA-A receptor. It is used to treat insomnia, anxiety, and neurosis in some countries like Italy, India, and Japan. But in UK, it's illegal and it's classified as a Class C drug due to the toxicity of the molecule at high dosage. It has been involved in many deaths in the UK because some people use it as a recreational drug because of the euphoric effect and the relaxant effect it has on the body. So it is important to know how to detect it with laboratory technique. So I will resume the techniques. We have the thin layer chromatography, the UV spectroscopy, the nuclear magnetic resonance, and for the forensic techniques, we have the liquid chromatography coupled with mass detector and the ELISA immunoassay test. Thank you for your attention. If you have any question, come back to us. Thank you.